I get it. Cost is insane right now, and as we head into open enrollment 2026, you as an employee are trying to figure out, how can I get my needs met while spending as little money as physically possible? That's a lot harder than it sounds, or is it? Maybe it's actually pretty simple if you just take a couple of key steps. I'm Lindsay, I'm an HR consultant alongside my buddy Nate, who is a benefits broker, and today we want to talk to you about things that you as an employee can do to help drive down your individual spend but still receive the care that you need. So Nate, what's your first suggestion?
First suggestion is ask questions. Always be someone who's willing to go to the ends of the earth to get the answers you need. I always talk to employers today about making sure we're educating employees on how to use their current plan types the right way. So two options when I think about the marketplace today. Number one is a lot of us don't understand a lot of terms and what's going on in the market. So we, as an employee benefits broker in the market today, I love educating people. I love teaching employers, but ultimately I'm in a situation where I do what I do because I was one of those people at some point that asked a lot of questions and didn't get answers today. So our personal situations with healthcare is always frustrating. But what we have to be willing to do is we have to learn and understand and listen to what's going on. So when you do have a healthcare spend coming up, ask the questions. Don't assume that that's the best route to go, and utilize the tools that are in front of you. You do have an HR team potentially in your office. You can reach out to one of us, but ultimately at the end of the day, ask the questions, become educated. The other side of the fence is understanding the kind of plan that you have today allows you to make better informed decisions. We typically know, and we've said this in other videos, that if you go to the ER every time, that's your highest cost spend that you're going to run into. But there may be times where you go to urgent care. Maybe you go to your primary care physician. The best way is usually telemedicine and probably could handle 60, 70, 80% of the claims out there. So think about the tools and resources you have. When you do receive a bill, ask the questions of, why am I being charged this cost? There are many tools and resources that allow you to go through a conversation of, why was I billed this cost and not this cost? Why am I going to this care provider at this surgery center? There's many ways we can also offer second opinions on a cost for a surgery or a second generic drug that could potentially help you. That's still the formulary, and I'm using a lot of terms, a lot of formulary is the same, but it might be in a different name or different generic. So ask the questions, become informed, and make sure you're knocking on the right doors. If there's questions around that, go to the HR team, ask friends and family. Doesn't mean it's true or that you should take those recommendations, but the more you go down the rabbit hole, the more you learn, the more you become more of the term we like to use, an informed consumer of healthcare solutions in the market, or ultimately an educated person on the kind of care you have. If you are looking for some other tools and resources, we can recommend some, but there are great providers in the market that will even look at the cost that you were just given by a primary care physician or by a healthcare, by a surgery center or by some of these large hospitals. We can actually look at the bill and help you find those costs and where they're coming from.
Yeah, along those lines, one that I really want to encourage you to do, particularly for those of you like Nate and I who are in metro areas where you have choices, right? Nate and I live in Phoenix. We have a ton of options here. So for those of you in metro areas, I want to encourage you to be your biggest advocate. Okay, you know that no one knows more about you than you. And you have to be your own advocate. Like Nate said, second opinions are huge. Like the joke that we use here in Phoenix is, just because Mayo is the best clinic ever doesn't mean that you can't receive amazing care somewhere else.
Yep.
Nothing against our Mayo friends. They are fantastic, but historically, Mayo's probably the most expensive option available here in the Valley for just about anything that you're looking for. There are other phenomenal doctors, phenomenal surgeons, phenomenal specialists in other networks. Some of them stand alone. They're not part of one of the major networks. So being your own advocate and asking questions is super, super helpful. I see in Facebook groups all the time where people are saying, I'm going through XYZ. Has anyone else been through this? Who did you go to and did you like them? Now, I'm never going to tell you to take medical advice from Facebook because that's a terrible idea. However, it can be useful when you're trying to find, and when you Google something and you get 1,000 results and you're like, I don't even know where to start. It can give you an idea of where to start. There are apps available for employers who are interested in supporting this. There are apps available to help people find the best care given current situations. using some medical data. If you want to provide those to your employees, that would be an A+ employer move.
Yep.
And I highly encourage you to consider that alongside your benefit consultant. But being your own advocate, saying, I want to know that I'm getting the best possible care for the best possible price given my situation, cannot be understated.
Yep. I would add that at the end of the day, Lindsay already said this, you have to be an advocate for yourself. So the priority should be thinking about when I receive a bill or if someone is making a recommendation, taking that recommendation and thinking about how else do you shop for other things. You're utilizing all those other tools and all those other solutions. So there are other tools in the market that you can utilize, such as you can go to your network website and look at the doctors that are there. Now, Lindsay already mentioned this. There are other tools, and you should ask your HR team this, that allow an organization to make recommendations to certain places and doctors and care that fits the network. Also, there's incentives and rebates that you're given and the employer is given to utilize certain care centers. So again, education is critical, but also making sure you continue to be your own advocate is the priority. I also look at, sometimes we get stuck in a situation and we just choose something because it was a recommendation. Take a step back, pull the emotion out of it. Although our care matters, take a moment, take a breath, take a night, and think about, I know I need the best care possible, but I also need to think about the fact that I don't want to receive a large bill. What's the best way to get the best coverage and care at the cost that makes most sense to me today?
Yeah, one of the other resources, particularly for those looking for mental health related services, that is huge today. And I 100% want to encourage you, if you're in a mental health situation or you know someone who is, please seek that assistance. It is absolutely available to you. Many employers offer an EAP, or an employee assistance program. It's free to the employee to use, and you typically get between 3 to 5 free counseling sessions, free 99, my favorite price of all time, available to you through your employer's EAP that you can use to deal with some short-term acute situations. All EAP services that I know about are all 24/7 available, phone, website, apps. There are plenty of ways to contact them. And oftentimes they're available not only to you as the employee, but they're also available to those in your direct family and or those who live in your household, whether they're related to you or not. So healthcare today is not just about the physical things, it's also about mental health.
Yep.
And again, please seek those services if you need them. There are lots of options available through EAPs. You can also ask your EAP to say, hey, when you're picking somebody for me, can you pick someone who's in network for me?
Yeah.
And that way, when your EAP services run out, you don't have to change therapists when you roll into your insurance. So those are options that are also available that maybe you hadn't thought about, but can start off as free to help keep your costs down and then can roll into insurance later.
Yep.
So there's tons of, literally we could sit here and we could probably talk for like 3 hours about this.
Yep.
There are so many ways for you to advocate for yourself. Again, the biggest thing, it is about you advocating for yourself. It is about you doing what you are comfortable with. Oh, the one I don't want to forget about, EOBs. So this, ever seen this little piece of paper that comes in the mail and in great big letters it says, this is not a bill? It's not a bill, but what it is it's your check and balance. So hold on to those. When the actual bill comes, take that bill, take that EOB, and compare them to each other.
Yep.
Why? Because most medical billing is wrong in the United States.
Yep.
So your EOB comes from your insurance company, and it tells you, based on our contract with that particular provider that you saw, this is how the math should work. It started here, we paid this much, you're gonna pay this much. And if that bill doesn't match, then it's time to start ringing people up and saying, hey, you overcharged me.
Yep.
That's a great way to save money. Yes, it takes you a little bit of time. Some broker partners will help you do that. So ask your HR department. He's one of them. Ask your HR department if your broker partner is one of the brokerages that helps employees fight those bills.
Yep.
But it's a 3-second, completely free, but easy way for you to make sure that you're not getting overcharged by a provider's billing office, which by the way is not your provider themselves. So don't go hate on them. It wasn't them who overbilled you. It's a service that they use, but that's an easy way to check and balance and make sure you're not paying more than you're supposed to.
Most bills that people receive in the US have something wrong with them. And again, I don't necessarily know the stats that are out there today. If I had it in front of me, I'd share it with you. But the primary conversation, or the primary thing you need to think about, is question what you have in order to make sure that it's correct. Because right now, healthcare costs in America are rising, and there's no secret that there's a ton of middlemen, and we can go into all of those conversations about that some other time. But be an advocate for yourself and sit down and look at the bill and take 10, 15 minutes to make some phone calls. Heck, go on the internet, research, ask questions, ask your HR team, go and find the research and the answers that you may need to know about why you were charged what you were charged. I really passionately believe that it's about providing better care at a better cost to every member that ultimately utilizes our services. So it's definitely a primary conversation we're having with all of our employers around educating employees on, when you look at a EOB, is making sure you understand what it is, how it works, and then advocating for yourself. What does that look like? What resources are we providing through the employer to help them do that? And then what resources are available just by utilizing the network that's in front of you and the tools on the website and through the app that are available.
So don't let all the news you're hearing about all the things that are happening scare you. Yes, there are some things going on, but that doesn't mean that you as an employee, you as a human being, do not still have options. Advocate for yourself, go do the hard work, and we're here to help you if you need it.